Welcome, Mr. Prasad. And
Thank you.
I'm really honored and proud and privileged that you are there,
Thank you, sir.
especially because we are releasing a new technology, Rosa and Mazor X, which are two robots. One is a spine and a brain robot. And we also believe in the precision that you believe in. The swing of the ball, where it has to hit the bat, such that somebody at the back will hold it.
The accuracy.
The precision.
Very
You
true.
get that swing and you calculate that everything in your mind and you do it, which is a fascinating thing. Similarly, we also want to be precise because human life is something that is very precious.
Very true.
And the brain
Absolutely.
and the spine both are very precious because once you damage them, it's in bad shape. So we need to go precisely into a particular area and then place it. That precision, that accuracy is what we believe in, as you would believe in.
That's why we have Dr. Doc with us.
Sure, thank you.
So there is machine, there is no doubt, but the man behind the machine is also equally important.
So again, that is one important point. It is, you can have the Hawkeye, you can have this, you can have that, but when it happens, it has to happen.
Very
The
true.
Hawkeye will not tell you which edge of the bat you have to hit.
Exactly.
You have to do it.
Very true. Very true.
So
Yeah.
that is how it is. So welcome. And
Thank you.
From this, what do you think from your point of view?
Doc, it's a fantastic milestone, I would say, in healthcare technology and healthcare in technology. And it's a pleasure as well for me to be here and knowing that Aster CMI Hospital is the first to introduce Neuro spine robotic surgery. I mean, it's amazing. I think what a relief for the patients who are suffering with brain and neuro issues, isn't it? So I think it's a great initiative, great step that you have taken. In terms of enhancing the patient's lifestyle. I hugely appreciate that, and it's an honor for me as well, honor and a pleasure to be here as well. Thank you very much for having me, in the show and in this launch of Neuro spine robotic surgery.
Sure. Thank you so much.
Doc, so it's my question now to you is, for a common person watching this, what exactly does a robot do during surgery?
That's a very, very important and interesting question.
Yeah.
The main reason is everyone has this feeling that the robot is doing its job. So the doctor just sits with his hand closed
Yeah.
and robot does it.
True.
That's not true.
Okay.
The truth is, when we do something and when we want to accurately place it in some place, there are sometimes some human error can happen. Fatigue can come in. Your hands can be fatigued or something like that, or some small human part can come in and we can be a little inaccurate. Whereas with a robot, it can repeat 100 times, it's not going to get tired.
Very true.
And
Very true.
There's no fatigue. And we are feeding our knowledge, our plan into the robot. The robot knows only what we know. But at the point of surgery, if there's a change, we're able to feed the robot the change. So it's not that the robot does the surgery, it is the surgeon behind the robot who does the surgery, and the robot assists like many things.
So there's no need of any load management here, like what we talk in cricket.
Yes.
Especially for bowlers. There's too much of bowling somebody is doing, so you need to manage him.
Yeah.
So they give him rest. So in your case now, being robots being there, you don't have to really do much of a load
Exactly,
management as
exactly.
far as the fatigue is concerned for the doctor. I think that's great.
Another thing is when you practice,
Yeah.
you can ask a robot to bowl at you at whatever pace you want,
Exactly.
which a human being cannot do at some
very
point.
true. Very true.
But the batting you have to do, irrespective of what the ball is going to do.
Absolutely.
So you train, and then he can do 1,000 balls continuously with the same
Exactly.
pace.
Very true.
But you being a bowler,
Yeah.
at the end of the over,
Yeah.
your seventh ball
Yeah.
will be difficult for you to
Yeah.
get that same accuracy.
So no, it's great to have a robot to eradicate the human error.
Exactly.
Isn't it? That's amazing. Great. So that brings me to the next question. And does this actually improve the outcome for patients?
Yes. So I'll give you an example of a particular case.
Okay.
So we need to put electrodes into the brain, maybe 5, 6, 7, 8 electrodes into the brain
Okay.
to assess seizures where they arise from. When epilepsy,
Okay.
for example, in
Yeah, yeah.
epilepsy, the seizure comes from one point in the brain.
Okay.
We're not sure where. So we put in electrodes to find out exactly from where it comes. So one electrode putting in the conventional, non-robotic way would take at least 15 to 20 minutes for one. So you can imagine if you have to put 16. Whereas with a robot, the same thing can be done in half an hour.
Beautiful.
So one, it improves the accuracy. Two, it improves the speed. It reduces the tired feeling that the surgeon can have. All those things, but not compromising on the precision, not compromising on the place it has to be kept. Another scenario, we have got something called deep brain stimulation. In that, we put electrodes into a small nucleus.
Yeah.
In depth of the brain, nucleus is about 4 into 5 millimeters.
My
size.
God.
So, and you can't see it from here.
Yeah.
So we do a scan, we find out where it is, and then train or plan or help target that point with the robot. So when we do that, we put a frame, we put multiple things now. But with the robot, we don't need to put the frame. So the outcome is faster, the patient comfort is much better.
Amazing.
Without compromising precision.
Fantastic. Fantastic. So you have seen neurosurgery evolve over decades. Do you genuinely believe robotic assisted surgery is the future?
Yes. So let me tell you one more thing about neurosciences. If you look at oncology, you look at urology, which is gastroenterology and urology, the robots are much more advanced. So you can sit here and operate somewhere else. That is not possible with neuro. So we are getting there, we're not there as yet. So the potential of robotics in neurosciences is far more. And we're looking forward, we want to be front runners in that.
Fantastic.
And we're looking at that, we're looking at research. But at the moment, what a robot we have available does its job excellently well. And that probably will be slowly in the future. Cost is a big issue, but definitely the value of that is very important. Also, we have to keep a check on not doing it if it is not required. There are many surgeries it's not required. So we have to take an ethical decision which is to do, which not to do.
Fantastic.
And the future is there. Robotics is the way to go, but carefully we tread that path.
Fantastic. And what does today personally mean to you as the person leading this transformation?
So I'm very honored. I'm humbled by the fact that the Aster administration has trusted in me to give these things. And we've been having this association more than 10 years. Dr. Azad Moopen, he's a doctor himself, who's the chairman of this whole group.
Yeah.
He has this passion. And as a physician, his passion is to give the best care.
Okay.
And in neurosciences, we have been number one for quite some time. If you look at all the ratings and all that. And that is because of implementation of these equipment, implementation of technology, expensive technology to give it. And in Aster, we are able to cater to the lowest rung in society to the highest.
Brilliant.
So costs can be manipulated because our head is a physician. So he knows outcome is important. We'll take care of you and we'll do it well for you is what we all believe in. So therefore, in Aster Neurosciences, our aim is to get to one of the topmost centers, both in India and the world.
That was my next question to you is, where do you see Aster Neurosciences heading in the coming years?
So definitely we are among the top in India. We want to be the world's best. Already we have centers across the world. We go across the world and see patients and they start coming to India. It's easier to come to India than go to the US or to the UK to get this high-end technology. Now we are bringing all the high-end technology to India. And we want this neurosciences center to be one of the best in the world. I mean, that's where we want to go.
Fantastic. That is Dr. Ravi Gopal Varma himself talking about this. And this launch is not just about machines or technology. It is about improving precision, as our doctor said here, enhancing patient outcomes, as you've been saying, Doc, and shaping the future of neurosciences and spine care in India. Thank you very much, Doctor.
Thank you so much.
Very well done.
Very nice.
Congratulations.
Thank you.
This neuro brain robotic surgery is only available in Aster CMI hospital. I think it's one of its kind, and it's a great initiative and a brilliant milestone as far as Aster CMI hospital is concerned. So I've been talking to a lot of doctors, and most of the doctors talk about precision, And that's extremely important. Precision is equally important. The accuracy is equally important in cricket as well. But then here, we're talking about human life. So, they're taking out the human error, like how we do it in cricket as well, by introducing the third umpire or the DRS to eradicate the human error. So in the same breath here in the healthcare as well, to save human lives, which is more important than anything else, for the members of the family. So that's one of the reasons why the robotic surgery is equally important if somebody is going through an issue as far as their brain or spine is concerned. So what I would like to say is precision may come from robotics, but compassion, wisdom, and the surgeon's touch remain at the heart of brain and spine surgery.